For many people living in the Hilltowns of Western Massachusetts, that means solitude from the natural beauty of the land. But it also means you're a distance from most doctors and hospitals. The Hilltown Community Health Centers was established to meet the medical needs of the region. We spoke with Eliza Lake, Executive Director of Hilltown Community Health Centers, to find out more.
In 1950, a group of community members in Worthington decided that there was a real need in the Hilltowns and created the Worthington Health Association at the time. And it was a membership organization for quite a while. And created a center there that really was trying to meet the primary care needs of the residents of the Hilltowns and beyond. And since then has expanded fairly dramatically in terms of providing services in Huntington, which is about 15 miles away, in the 80s. And then in the 90s, we opened a health center in Huntington and now serve people from all over Western Massachusetts.
Now, I have lived for about 35 years in what I kind of consider the base of the Hilltowns, if you will. Folks, you won't like that, but in Westfield. And I know when I moved to the area, I heard stories about famous person, Nurse Bates, Florence Bates, who really was, in the early years, I guess, the heart and soul of Hilltown healthcare.
Yes, yeah. She had been working in Worthington, I believe, since the 30s, providing primary care, and was the one who came to the town of Worthington and said, we need to do something here, and then was the heart and soul of the organization, I believe, until I think it was the 70s, and is still revered by everyone in the community.
You touched on, in your very first comments, the growth, the expansion that's occurred, and also in terms of the services, not just the places you are. I mean, there's medical, there's dental, there's family and social services.
Yep. Yeah, so community health centers, which federally have been supported by the federal government for the last 50 years, this year is the 50th anniversary of that, are really committed to the bigger picture of health. So it's not just about primary medical care or dental care, but about all of the things that go into keeping people healthy in the community. So we are very pleased that we are able to offer primary medical care, dental care, optometry, behavioral health, and then a whole array of community services that can help people remain in the community and healthy and not have to go far afield to get those services.
And one of the things, excuse me, that impressed me reading up, preparing for our discussion, you have a facility at the Gateway School campus, the middle and high school, which it seems to me so important to work with the younger people for so many reasons, to be right there for them.
Absolutely, and one of the challenges we have living in such a rural area is that parents, if they want to take their child to the dentist or to the doctor, have to take time off from work, drive to school, pick up their child, take them to the appointment and bring them back. And so they lose productivity at work and the child loses a huge amount of time at school. And so we're really pleased that for over 15 years we've had a school-based health center which provides primary medical and behavioral health care. And then we also have our Gator Grins program, which is incredibly successful, which provides a full array of dental services to kids. And it's not just the middle and high school, but Littleville Elementary is right across sort of a field, and they are able to bring children over to be seen. And then Gator Grins at this point has a clinic that they put on at Chester Elementary School twice a year to provide services there. So we're really pleased about that. I think it's a really important thing we can provide for the community.
And in your center at the Gateway Regional and High School, the middle school and high school, you also have counseling, psychological counseling, and nutritional counseling, so important for young people.
Absolutely. Yeah, and a part of the mission for community-based health centers is to engage with the community and to provide more services than to address the needs that the community has identified. So nutrition counseling is important, having not just appointments available for students, but to go out and do education with the students about things like nutrition, about health, is really critical, and collaborating with the school system in providing that.
You know far better than I do, because of what you do every day, how complicated accessing health care can be today, or accessing really the means to be covered for health care. Everybody is so confused about what's being provided federally, what's being provided. Yeah, you hear this day in and day out. You folks have navigators on staff, on board, who work with folks, especially maybe lower income folks who really are going to have a hard time getting insurance or having coverage. And that's an important part of what you do.
Yeah, and it's critical, and we're very proud to be one of the navigator organizations in the state because there aren't very many of them. We have staff who are dedicated to helping people figure out what they're eligible for, help them sign up, make sure that they remain eligible or that they remain current, and then make sure that once they have that insurance that they have access to the services that they need. So we have, as you say, our navigators. Some of them are also certified as Shine counselors, which means that they are specifically trained in Medicare. And we will take all comers. Certainly, our mission is to serve all people regardless of their ability to pay in all of our services. So helping people get onto Medicaid or Mass Health is really critical. But we will help people get onto any of the qualified health plans that they might be able to get state or federal subsidies, or even just to get private health insurance.
And it strikes me that maybe navigators might be even more important in a rural area like this, only because I think a lot of times people come to an area like the Hilltowns because it is quieter, it is calmer. You can live a half a mile from your neighbor, but as you age, that being apart maybe can be that much more difficult maybe to work with and deal with than in another larger or closer buildings closer together community.
Yeah, and one of the things that I think we can do, which I think is invaluable in such a rural area, is our staff will go to people's homes if they need to. So our navigators will do home visits if necessary. And you mentioned the aging population. One of the programs I think that I'm very proud of that we have is our HOPE program, which provides nurses that go out and go to elders' homes. Because the way the current system works, if you have a chronic condition, you can't necessarily get visiting nurses, but there are still needs that people have for a nurse to come into their home. So we are able to do that. And then also, we are really developing our community health worker program, which is a national movement to have staff who can work from the community, who can work with people to improve their health. So our community health workers do a lot of work with going to people's homes, and then also, when absolutely necessary, providing them with transportation to get them to their doctor's appointments so that they can maintain their health.
All right, Eliza Lake, Executive Director, Hilltown Community Health Centers, thanks for coming in.
Thank you for having me.